How do I get rid of skin tags? Okay, first let's talk a little bit about what a skin tag is. The medical term is acrocordon, but I think the common term is skin tag, and these are growths that tend to occur in areas of friction around the neck, around the armpit area, under the breasts, inner thighs. These are all areas that are more prone to skin tags, but it can occur pretty much in any area of your skin. Most commonly, they're very, very small, but sometimes they can get quite big. They're harmless, but they can get snagged when you shave or get caught in your jewelry, so they can be really aggravating. And if you don't like how they look, there are a few things that we can do in the office to get rid of them. We can do what's called light cautery, where we use this electrocautery tool to kind of zap them. We can freeze them with liquid nitrogen. We can snip them off, usually with anesthesia first, local anesthesia to the area. Depending on the size, they don't really need a stitch to them. Sometimes we might cauterize the base if they like to ooze a little. Because the problem is with skin tags is they do have a blood supply, so they can do a slow ooze if you just try to snip them off. Now, if you go online, there's a bunch of home remedies for removing skin tags, like garlic, tea tree oil, even banana peels. You have to be so careful with this DIY dermatology because a lot of these things can cause bad permanent effects like burning, irritation, even permanent scarring. And even though it's super rare, your skin tag could actually be something else like a suspicious mole or maybe a wart. So it's best to get a doctor's opinion, especially if it's on the eyelid, because you could do some real damage there. Yay, what is the best way to get rid of acne scars? We need to get precise when we're talking about acne scars because there are different types. Acne scars by definition are scars that are sort of permanent, that are there because of inflammatory or severe acne. And then there is actually something that a lot of people call acne scars, but really I don't as a dermatologist because they are not permanent. It's usually post-inflammatory hyperpigmentation or post-inflammatory hypererythema, which is just brown spots or red spots that you might have after an acne breakout. True acne scars come in 5 forms: ice pick scars, boxcar scars, rolling scars, hypertrophic or keloid scars, and anatoderma. These are typically the result of deep inflammatory acne that causes damage to the surrounding tissue. They can be really tough to treat, but sometimes lasers, chemical peels, subcision, punch excision, or even dermal fillers can help to minimize their appearance. Post-inflammatory hyperpigmentation, on the other hand, is when you get a dark mark, which is excess melanin that appears as a pimple heals. These dark spots tend to go away on their own with time, but you can speed it up with ingredients like retinol or hydroquinone, which is in my SLMD Skincare Dark Spot Fix. Follow the label instructions on that, you guys, because you need to take breaks from hydroquinone to maintain its effectiveness.